treatment for borderline personality disorder, BPD, psychodynamic therapy and emotion-focused therapy. Borderline personality disorder, BPD, is a complex and challenging condition, and its treatment often requires a multifaceted approach. While therapies like dialectical behavior therapy, DBT, and cognitive behavioral therapy, CBT, are commonly used, psychodynamic therapy and emotion-focused therapy, EFT, are also important and effective treatment options for individuals with BPD. Both therapies focus on understanding the underlying emotional and relational dynamics that drive the symptoms of BPD and offer ways to address these deep-rooted issues. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore psychodynamic therapy and emotion-focused therapy, EFT, discussing how they help individuals with BPD understand the emotional origins of their struggles, build healthier relationships, and develop emotional resilience. What is psychodynamic therapy? Psychodynamic therapy is a form of psychotherapy that focuses on exploring the unconscious mind and how past experiences, particularly early childhood relationships, influence current behavior, emotions, and interpersonal dynamics. This type of therapy is based on the idea that unresolved unconscious conflicts, often stemming from early life experiences, are at the core of psychological problems, including those seen in BPD. Core principles of psychodynamic therapy for BPD. 1. Uncovering unconscious processes. In psychodynamic therapy, the therapist helps the individual become more aware of unconscious thoughts and emotions that influence their behavior. Many individuals with BPD have learned maladaptive coping strategies and relational patterns based on unresolved past experiences. For example, early attachment issues, childhood trauma, or abandonment experiences may contribute to emotional instability and fear of rejection in adulthood. The goal of psychodynamic therapy is to help the individual uncover and process these unconscious conflicts so they can be addressed and resolved. This insight allows them to better understand how past experiences are shaping their present behaviors, particularly in relationships. 2. Exploring past relationships. Psychodynamic therapy often focuses on past relationships, especially those with primary caregivers and early figures in the person's life. By examining these relationships, the therapist helps the individual understand how their early experiences may have led to attachment difficulties, emotional vulnerability, and relational instability, common features of BPD. The therapist may help the individual connect the dots between past and present experiences, allowing them to break free from unhealthy relational patterns and build healthier connections in the future. 3. Transference and countertransference. In psychodynamic therapy, the concept of transference is a key therapeutic tool. Transference occurs when the individual projects feelings, thoughts, or patterns from past relationships onto the therapist. For example, they may see the therapist as a parental figure or transfer unresolved feelings of anger or abandonment onto the therapist. The therapist carefully explores these feelings to help the individual understand how these past emotions are being recreated in the present. Additionally, countertransference, how the therapist's own emotions or reactions affect the therapy, is also examined to provide a deeper understanding of the therapeutic relationship and help resolve the patient's emotional difficulties. 4. Working through defense mechanisms. Psychodynamic therapy also addresses the defense mechanisms that individuals with BPD often use to protect themselves from emotional pain. These may include splitting, projection, or denial, which can prevent the person from seeing reality clearly and contribute to relationship instability. By bringing these mechanisms into awareness, individuals can begin to break free from them and adopt healthier coping strategies. Benefits of psychodynamic therapy for BPD. Deeper self-awareness. By gaining insight into unconscious conflicts, individuals with BPD can better understand their emotional responses and relational patterns. Improved emotional regulation. Psychodynamic therapy helps individuals connect their emotions to their thoughts, allowing for better emotional processing and regulation. Addressing root causes. This therapy works to address the deep-rooted causes of emotional instability and fear of abandonment, ultimately reducing the intensity and frequency of these symptoms. What is emotion-focused therapy, EFT? Emotion-focused therapy, EFT, is a therapeutic approach that focuses on helping individuals understand, express, and regulate their emotions in a healthy way. EFT is grounded in the belief that emotions are central to human experience and are critical to shaping behavior, thoughts, and relationships. For individuals with BPD, emotional dysregulation is a core symptom, and EFT helps individuals understand the complex nature of their emotional experiences and learn how to process and express them more effectively. Core principles of emotion-focused therapy for BPD. 1. Understanding emotions as signals. EFT views emotions as important signals that provide valuable information about our internal experiences and how we relate to the world around us. For individuals with BPD, emotions are often overwhelming and uncontrollable, which can lead to impulsivity, self-destructive behaviors, and difficulty in relationships. EFT helps individuals recognize that emotions, even difficult ones, are not inherently negative but can serve as valuable tools for self-understanding and growth. Identifying emotional needs. EFT helps individuals with BPD identify the emotional needs underlying their feelings, which may be related to rejection, loss, or abandonment. By acknowledging and validating these needs, individuals can learn to respond to their emotions in healthier, more constructive ways. 2. Processing and transforming negative emotions. EFT helps individuals process negative emotions like shame, guilt, and fear, which are often intensified in BPD. Instead of avoiding or suppressing emotions, EFT encourages individuals to fully experience and express their feelings, allowing them to move through emotional pain and achieve healing. Transforming maladaptive emotions. In EFT, individuals are guided to transform maladaptive emotions, such as anger or sadness, into more adaptive feelings, such as acceptance and self-compassion. This process helps reduce the intensity of emotions and their disruptive impact on behavior. 3. Emotional validation. Central to EFT is the practice of emotional validation, recognizing, acknowledging, and accepting the individual's emotional experience as valid. For individuals with BPD, emotional validation is essential because they often feel misunderstood or invalidated in their emotional experiences, which can exacerbate their distress. Providing empathy. The therapist offers empathetic responses to the individual's emotions, helping them feel understood and accepted. This creates a safe space where individuals with BPD can begin to trust their emotional experiences and connect with themselves in a healthier way. 4. Building emotional awareness and regulation skills. EFT teaches individuals with BPD how to increase their emotional awareness and regulation skills. By becoming more aware of their emotional triggers and responses, individuals can learn to pause before reacting impulsively and instead choose healthier ways of managing their emotions. Emotion regulation techniques. EFT provides practical tools for managing emotional distress, such as grounding techniques, deep breathing, and emotion labeling. These skills help individuals navigate difficult emotions without resorting to destructive behaviors. Benefits of emotion-focused therapy for BPD. Increased emotional awareness. EFT helps individuals with BPD become more attuned to their emotions, allowing them to better understand and regulate their feelings. Improved emotional regulation. By processing emotions in a safe and structured way, individuals with BPD can learn how to manage intense emotions without resorting to impulsive actions. Enhanced self-acceptance. EFT fosters self-compassion and emotional acceptance, helping individuals feel more at peace with their emotional experiences and more capable of managing them in healthy ways. Comparing psychodynamic therapy and emotion-focused therapy for BPD. Both psychodynamic therapy and emotion-focused therapy, EFT, can be highly effective in treating borderline personality disorder, BPD, but they focus on different aspects of the disorder. Psychodynamic therapy focuses on exploring past experiences and unconscious conflicts that shape current behaviors and emotional responses. It helps individuals gain insight into the underlying causes of their emotional struggles and relational instability. Emotion-focused therapy, EFT, emphasizes emotional processing and regulation. It helps individuals with BPD identify, express, and transform their emotions, leading to improved emotional stability and healthier coping mechanisms. Both therapies work to address the emotional dysregulation that is central to BPD, but in different ways. Psychodynamic therapy focuses on self-awareness and insight, while EFT provides practical skills for managing emotions and improving interpersonal relationships. Conclusion: Psychodynamic therapy and emotion-focused therapy, EFT, offer powerful tools for individuals with borderline personality disorder, BPD, to understand and manage their emotions, improve relationships, and lead healthier lives. Psychodynamic therapy focuses on the unconscious and past experiences, helping individuals understand the roots of their emotional struggles, while EFT focuses on emotion processing and regulation, equipping individuals with the skills to better manage their emotions in the present. Each approach offers unique benefits and can be used in conjunction with other therapies, such as DBT or CBT, to create a comprehensive treatment plan. In future episodes, we will explore other therapeutic approaches to managing BPD and how they contribute to emotional healing and stability. Stay tuned for more insights into borderline personality disorder and its treatment.